Assalamualaikum warahmatullahi wabarakatuh. Hi everyone. Good happy always to everyone, especially for my literature English communication. Now my presentation about personal health. My topic, mental health lockdown in Malaysia. Okay everyone. For my name, JANNATUL Salihin bin Abu Talib. Subject English for Oral Communication, course cluster of Education and Social Science. First coronavirus disease, the 2019 coronavirus disease COVID-19 outbreak has been declared an international public health emergency on January 13, 2020 by the World Health Organization. This infectious disease has been causing universal awareness, anxiety, and distress, all of which, according to WHO, are natural psychological response to the randomly changing condition. Impact of COVID-19 on public mental health. It is claimed that the coronavirus disease 2019 COVID-19 pandemic has had a negative impact on mental health. It is well known that pandemic pose a threat to mental health. Young adults have experienced a number of pandemic-related consequences, such as closure of universities and loss of income that may contribute to poor mental health. During the pandemic points, to concerns around poor mental health and well-being for children and their parents, particularly mothers, as many are experiencing challenge with school closure and lack of child care. Women with children are more likely to report symptoms of anxiety and or depressive disorder than men with children. Many essential workers continue to face a number of challenges, including greater risk of contracting the coronavirus than other workers. Compared to non-essential workers, essential workers are more likely to report symptoms of anxiety or depressive disorder, starting or increasing substance use, suicidal thoughts during the pandemic. Job loss is associated with increased depression, anxiety, distress, and low self-esteem, and may lead to higher rates of substance use disorder and suicide. During the pandemic, adults in households with job loss or lower incomes report higher rates of symptoms of mental illness than those without job or income loss. Young adults throughout the pandemic, anxiety, depression, sleep disruptions, and thought of suicide have increased for many young adults. They have also experienced a number of pandemic-related consequences, such as closure of universities, transitioning to remote work, loss of income or employment that may contribute to poor mental health. Adults experiencing job loss or income insecurity. Throughout the pandemic, many people across the country have experienced job or income loss, which has generally affected their mental health. Adults experiencing household job loss during the pandemic have consistently report higher rate of symptoms of anxiety and depressive disorder compared to adults not experiencing household job loss. In addition to increased anxiety and depression, job loss may lead to other adverse mental health outcomes, such as substance use disorder. During the previous recession, the high unemployment rate was also associated with increase in suicide. Parents and children, to help slow the spread of coronavirus, many schools and child care centers have closed and transitioned to virtual instruction for at least some time. With its closure, children and their parents are experiencing ongoing disruption and change to their daily routines. Essential workers during the COVID-19 pandemic, such as health and care providers, grocery store employees, and mail and package delivery personnel, have shown high rates of poor mental health outcomes. These workers are generally required to work outside of their home and may be unable to practice social distance management. Close monitoring of mental state of parenting persons, physiotherapy or online intervention, shorter working duration, regular rest period, rotating shift, sufficient supply of appropriate PPE, arrangement for equipped isolation ward specific for infect medical staff, insurance system for doctors, online class, online study, material and maintenance of sleep cycle, physical exercise schedule, etc. for children, session via telephone, online video conference and mental health service, home-based exercise and drug delivery system via online approach for all age population. Thank you.